dementia only describes a collection of symptoms. So obviously we usually think of memory loss, but there are lots of other things that this could encapsulate that we'll go into a little bit later. The main type that most people know of is Alzheimer's disease, which is about 60 to 80 types of dementia, but there are a lot more. So sources range from over 100 to over 400 types of dementia. So apart from Alzheimer's, you might come across frontotemporal, Lewy bodies, and you might come across ones that either mixed, early onset, so in children, for example, or ones that progress very quickly over the course of days, weeks, or months. So moving on to the next slide, please. So this is just quickly to have a look at what it can affect. So frontal lobe, we talked about there. So a lot of the things you see is emotional traits, and frontal temporal, so behavior. So often these patients, you might find they're actually maybe aggressive because of the problems they have with that. They might find it difficult to reason, make judgment, explain what they're feeling and thinking, and that voluntary motor activity as well. Whereas if you look at the cerebellum, balance, you might have a patient that's falling more often. Most dementias have some sort of set way of acting. So things like you'll have urinary continence before you have fecal incontinence generally. But it just depends on what part of the brain is affected, and there's loads of things that can affect. So everyone that has a dementia has a different experience of dementia, not just because of who they are, but what part is being a thing in the brain. So what you'll find is initially there's not much that you might see when somebody has dementia at the start, but if you can get an early diagnosis, you can delay progression. So make sure any worries that you have are followed up on. And again, just looking at these, you know, if your short-term memory is affected, or you're falling a lot, or your continence, weight gain, weight loss, dietary issues, communication difficulties.